We are here at Eye Care Specialists in Kingston, and I'm excited to introduce you to one of those eye care specialists, Dr. Daniel Lutz. Thanks so much for having us.
Thank you.
And we know that you are kind of the glaucoma expert, not kind of, you are the glaucoma expert in the area. Let's start basic, though, for the folks at home. What is glaucoma?
All right, well, glaucoma is an eye condition where the eye pressure is imbalanced. So the eye makes its own pressure and it drains its own pressure. But if that's out of whack in such a way that the pressure goes up, it's kind of like riding on a tire that's overinflated. So when you look inside your door, you got that perfect pressure. But if you're above that, you're going to burn out the rubber quicker. So the eye is kind of like that. If you have too high of a pressure, the eye is very delicate. It can't handle that many pressure changes, and therefore you can lose vision from having a high pressure. We call that glaucoma.
Yeah. And I know a lot of your patients here, rely on you guys to help with their cataracts as well. And you can kind of two birds with one stone, glaucoma and cataracts at the same time. What's the technology like that for a procedure like that?
Right. So the routine cataract is more or less straightforward. You take out the cloudy lens that's developed inside the eye, and you put a new one in its place. When you have glaucoma at the same time, we basically have two options. You can either turn off the production of pressure a little bit, and we have lasers for that. We have the ECP laser. We have the diode transscleral laser. The big one really is enhance the outflow, so to open up the natural drains or put a new drain in the eye so that you can get the pressure down that way. So we have the original iStent, which is a 1 millimeter little snorkel-looking device that you plug into the natural drains. We have the Hydrus, which is even bigger and arguably more effective. And then there's other bigger and bolder ones like the Xen Gel, which is a 6 millimeter implant that shunts the pressure from inside to outside. And there's various other ones as well, but the devices that can enhance the outflow and lower the pressure that way are basically the standard of care these days. So.
And you guys here at Eye Care Specialists are always reminding us that the best way to get ahead of some of these potential issues is to come in and see you guys on a regular basis. Who might be watching right now that you definitely recommend comes in to start those annual appointments if they're not already?
Right. So certainly, yeah, the yearly exam is important, the yearly eye exam, just to update your glasses or to see if you indeed have a cataract. Especially if you have a family member, that's one of the biggest risk factors. If it's a much increased risk of having glaucoma yourself if you have a first-degree relative, so a parent or a sibling. When you come in, we're going to check everything out. We're going to check if you have cataracts, you're going to check your pressures and all that. The big key is to listen to what your doctor has to say, take your drops if indicated. We also have lasers to treat, so there's various avenues that we can control the glaucoma so you do not lose the vision. We even have some investigational studies to include some new eye drops that are not yet on the market. So we have various options for people to try.
Yeah, you guys can really cover your bases here at Eye Care Specialists in Kingston. You can always head online to learn more about the different services they provide, including Dr. Lutz here. Thank you so much for having us and for sharing some more information.
Certainly. Anytime. Thank you.